Start. Yes, Joan, very good evening. And definitely, we will discuss some important areas. All right, dear students, now we will start our session. Just acknowledge, is everything fine? So there was a little bit glitch at that time. Okay, now we'll continue. All right. So, yes, thank you so much. And just before it beginning of the session, I would like to wish you all happy Doctor's Day. Thank you for your wishes. Now, okay. All right. So let's start, dear friends. So, dear students, this is the question number 1. Which of the following projects efferent fibers to the mark structure? So, this image, particularly the section, is very important for you guys. Okay, based on this section, they can ask question on the basal nuclei, they can ask question on the insula, the corpus callosum, septum, anything. They can ask on the ventricles. Okay, so the whole system, whole thing is very, very important. And dear friends, what is the marking over here? Before this, I would like to draw this particular part. What if this is nothing but the corpus callosum, correct? And what I am drawing right now is the septum between the two lateral ventricles. This is the lateral ventricle on each side. Between the two lateral ventricles, we have the septum called as septum pellucidum. And then we have the two columns of the fornix over here. This is the fornix basically. If you take a section in the middle, it will be looking round. But if you take anteriorly, it will be splitting into the columns like that. Okay. So it can be either way. Either it can be two column or it can be central round structure, but it is a fornix over here. Okay. So the mark structure is fornix. The mark structure is nothing but the fornix. Now the question is, fornix is the efferent from? Answer is hippocampus. Okay. Answer is hippocampus. Now, regarding hippocampus, it will be sending the efferent as fornix, but this efferent will reach efferent where? As efferent, it will reach the mammillary body. And in this aspect, it is important for us to understand about something which is very important called as Papez circuit. Okay, answer will be hippocampus. That's okay. But we will also add over here, that is Papez circuit. Okay. And for the Papez circuit, please remember this mnemonic, which is called as hippomaze, which is called as hippomaze. So we have hippocampus, okay, and from the hippocampus we have, this is like mammillary body. From the hippocampus, the fibers will come in the form of fornix, which will be reaching here at the mammillary body. That will be sending the fibers to the anterior nucleus of thalamus, anterior nucleus of thalamus, and then to the cingulate gyrus, and then to the entorhinal cortex, and then to the entorhinal cortex. You guys will be getting this annotated PDF beta, hai na? You will be getting this. Don't worry about it. So this becomes a circuit. And what is the role of the circuit? We all know it is involved in the recent memory consolidation. Okay. If during the accident, hippocampus goes into shock because accident occurs so sudden that it doesn't get time to, process all the whole information. So it goes into shock. In that case, Papez circuit is not completed, and you ask the patient after the accident is done, like when you stabilize him, you talk to him. Then recently he will be talking all nicely, like he will be oriented to time, place, and person. If you ask the remote things also, he will be able to tell. But if you ask the things like around the accident, how it happened and all, he won't be able to tell. है ना, उसको याद ही नहीं होगा क्योंकि उसको समझ ही नहीं आएगा. उसको लगेगा कि यार मैं घर से निकला पता नहीं क्या हुआ, like that, है ना. So that's something very important. And you will get these type of cases. It's not that something theoretical. You will get these type of cases are seen in clinical practice. Okay. So now we are done with this area. Could you appreciate, beta? Everything okay? As I said in this section, you should understand. If I ask you, what is this? Can you tell me what is this? Where I have marked this line. This is insula. Okay. So this part is the insula. And what is this? Where I am writing T is the thalamus. T for thalamus and T for third ventricle. Between the thalamus, we have third ventricle. These two are the lateral ventricle. And can you tell me, beta, what is this black dot over here? This black dot is the caudate nucleus. And this lens-like is the lentiform nucleus. Now my question to all of you, everyone. Now my question to all of you, what are these fibers between this caudate, thalamus and the lentiform? What are these white fibers passing below as, what is this? Some capsule. What is that? Internal capsule. What is this? This is internal capsule. So whenever you are reading one question, when you are looking at one image, do not only look at the question and answer. Go beyond that, because question will be asked from one topic, not from one set of PYQs. Okay, so when we say PYQ, always look at the PYTs, because topic to same ही रहेंगे. Important topic से question आएंगे. As I said, this image is very important, and you will agree because you must have seen the PYQs. Lot many questions have been asked from this area, isn't it? And yes, it gives me pleasure to see some students have gone one step ahead and they're telling it's a projection fibers. Very good, beta. Can you also give example of fornix? Fornix is having what type of fibers? The question was about fornix. Question was about fornix. Fornix is having what type of fiber? Association, commissural, projection, or all? What will be your answer? Answer will be all. Fornix is having all three set of fibers: association, commissural and projection, beta. Okay, do you appreciate? All right, now we have understood all these parts. Let's move ahead, and this image is given to us. Area A is marked. Area A is marked, and the question says damage to the structure producing the marked elevation. Okay, damage to the structure was responsible for the marked elevation. So who is responsible for the marked elevation? What is the marked elevation? Marked elevation is nothing but the facial colliculus. And the facial colliculus is produced by the facial nerve. It is produced by the facial nerve. Okay. And it is produced by the facial nerve around the sixth nerve nucleus. The question is, if the damage to the structure producing the marked elevation. So that will be the seventh nerve, and the seventh nerve will be supplying the risorius muscle, which is the muscle of grinning, All right. All right. Now the question here is, if they change the language, beta, if they change the language, ए कब होगा? हाँ, उसी के बारे में बोल रहा हूँ. ऐसा तो नहीं है कि हमेशा वो सेवन दर पे क्वेश्चन बनाएंगे. मान लो लैंग्वेज को ही चेंज कर रहे. Suppose they change the language. If they say damage to the nucleus deep to the marked elevation, then which nucleus is deep to it? Sixth nerve nucleus is there. In that case, answer will be lateral rectus. Okay. Or if they say damage to the structure deep to the mark elevation, in that case 7th and 6th both can be considered because deep में तो दोनों ही है. अगर वो न्यूक्लियस स्पेसिफिकली बोलते हैं तो 6th आंसर होगा. स्ट्रक्चर रिस्पॉन्सिबल फॉर द मार्क एलिवेशन तो 7th होगा. If they say structure deep to it, then 7th nerve and the 6th nerve nucleus both will be the answer. है ना? Because deep to that structures तो दोनों ही है ना? So depending upon the language, you have to play along. I hope that makes it clear, right? Everyone okay? All right. So, dear friends, let's move on. And this is what we have got the floor of fourth ventricle. Let me just explain. These are the superior colliculi and these are the inferior colliculi of both sides. ठीक है. And यहाँ पे क्या है? Superior cerebellar peduncle है. Middle cerebellar peduncle and inferior cerebellar peduncle. All right. And this is the midline. Median sulcus is there. And if I add here, just for the sake of one theoretical question, if I add some bluish green area in the upper part of bones, can you make a guess what is this bluish green area over here in the upper part of the bones in the floor of fourth ventricle beta? Can you make a guess? What is this area? What is this area? Guess quickly. Bluish green pigmented area in the upper part of bones in the floor of fourth ventricle. What will be your answer? Answer will be locus coeruleus. And what is it concerned with? Locus coeruleus is concerned with what? It is concerned with the production of norepinephrine. Norepinephrine. Yes, very good. Now the next question. Structure injured while resecting the free edge of lesser omentum will be all except quickly. Shoot your answers quickly. Right. बताओ क्या होगा इसमें आंसर. Free edge of the lesser omentum. We know that this is the epiploic foramen over here. Boundaries are this. This is the lesser omentum between the liver and the stomach. And this lesser omentum, this becomes the right free edge, free border. है ना? यहाँ पे तो attached नहीं है. So that is the anterior wall, right? That's the anterior wall. And here you can see stomach, pylorus, that's the duodenum first part. So first part of the duodenum. Above we have the liver, caudate lobe of the liver specifically. Okay. So we can see the anterior boundary, we can see inferior boundary, we can see superior boundary also. And if you take a section, like this, now you can see this is liver over here, this is the stomach. This is spleen, this is kidney, okay? Again, this is kidney of the left side. And here we have the vertebra, okay? And here we have aorta, we have the IVC, and this is the right-sided suprarenal gland. So this is the right kidney and the right suprarenal gland. This one is the left kidney, and we are not bothered about the suprarenal right now. And if I zoom in and show you, this is the epiploic foramen over here, and the boundary posterior wall is made by these three structures: IVC, right-sided suprarenal gland, and the vertebra, T12 vertebra. Do you appreciate this much part? And in this section, we can see that in this part, what is this? What is this, beta? In this free margin, we have portal triad. In this free margin, we have portal triad. And what structure is over here? What structure is over here? Along the lesser curvature, we have the gastric artery, majorly left gastric, but it can be right gastric also. Majorly left gastric, but it can be right gastric also. And can you tell me what will be contained here in this ligament? What is ligament? Gastrosplenic ligament between the stomach and the spleen. Can you tell me this gastrosplenic ligament? Look at the name of the ligament. The trick is, look at the name of the ligament, gastrosplenic. First word, gastro. So short gastric artery. It is having the gastric artery. First word is gastro. It is having the gastric artery. And this ligament over here is between the kidney and the spleen. Okay, the name is linorenal. First word lino. Lino means spleen. So splenic artery. It is containing splenic artery. I hope that makes sense now. You got idea, beta? Yes, everything okay? Fine. So after having understood all, see, whenever we are looking at a question, we have to go beyond the question also. I hope that makes it clear. सारे ओवरऑल टॉपिक को समझना, ये नहीं है कि आंसर लगाने, आंसर तो फिर 5 मिनट में खत्म हो जाएगा, राइट? And we know the portal triad. Which one of them is not the portal triad structure? Yes, quickly tell me, beta. Which one of them is not the portal triad structure? Obviously, hepatic vein. That's what is the answer over here. ठीक है, चलो. Now the next question. First of all, this particular sign. Tell me, when a patient takes the right foot above and the right hip is dropping, right foot above, right hip is dropping, which sign is positive now? Which sign is positive? Let's go step by step, beta. I know that you are very well aware of this area, but I want to know all the stuff step by step. What is the name of the sign? What is the name of the sign? Okay, let me draw over here. So I can say, okay, this is what pelvis is there, and this is the muscle. This is the muscle. This is the foot on the ground. This is the foot off of the ground. There is no support. Because of no support, this tilt is expected. But the tilt will be prevented by this sided muscles like that. If they cannot work, then the tilt will be seen. If they cannot work, then the tilt will be seen. The name of sign is Trendelenburg sign. Trendelenburg sign. What's the name of the gate? Yes, quickly. Name of the gate, beta. Name of the gate. Unilateral and bilateral. The name of the gate, unilateral and bilateral. What do we say? Lurching gate and Wedling gate. All right. Now the next question is, if the right side is showing the dipping, in which side the patient has got the weakness? In which side the patient received the injection? So patient receive injection in the buttock. Which buttock? Left or right? Right hip is dropping, means the weakness is in the left side. So which buttock he has received the injection? Left side. If left side buttock he has taken injection, which nerve is injured? Which nerve is injured? The nerve injured is superior gluteal nerve. And which muscle is involved? Gluteus medius and gluteus minimus, which are supplied by superior gluteal nerve. And if it is gone, we are looking at which quadrant of the buttock? Superomedial. A is the answer, beta. A is the answer over here. All the steps are clear. All the points are clear, beta. Yes or no? Everyone? So when you look at broadly, without thinking of the orientation, you will think, okay, all of them are coming from behind because the gluteal region is behind. So pull will be from behind. So behind pull means lateral rotation. That's not true. Look at the gluteus maximus, where it is like, suppose this pen is representing the femur. Gluteus maximus will be attached behind the femur. Gluteus medius will be attached lateral to the femur, and gluteus medius will be attached anterior to the femur. So what will happen? This is having the role chief extensor, but it can also do abduction. It can also do lateral rotation. Chief extensor is the major role, but it can do abduction. It can do lateral rotation also. But these two muscles are powerful abductors and powerful medial rotators. I hope that makes sense. Okay. And this is where we should give the injection, that is in the upper and outer quadrant. And by mistake, this injection was given here, leading to Trendelenburg sign positive. Now this question, beta. Yes. Tell me, which finger is having two dorsal interossei muscle? What is your answer? And let us discuss the concept. Ideally, we should give the injection in the superior lateral. Adil, let me show this diagram again. See, ये जो injection का site बना है ना superior lateral, क्योंकि यहाँ पे कुछ important structures नहीं होते. Upper and outer quadrant is where we should give. By mistake, he was given here. So superior gluteal nerve is also at risk. Sciatic nerve is also at risk. But this question was based on the superior gluteal nerve. Okay, like that. Answer is middle finger. But what is the concept? Concept is more important for us. Let's discuss the concept. So let us discuss one by one. First, let us discuss this. This is the pad. What is that? Palmar interossei does the adduction. Now, Let me zoom in to explain, and let me explain this way. When I say adduction means coming towards the axis. This finger can be adducted, this finger can be adducted, this finger can be adducted, and the thumb can also be adducted. But what about the middle finger? Middle finger is already in the axis. Middle finger is already in the axis. जो अब axis में ही है, वो axis के further करीब कैसे आएगा? The one who is already in the axis, you cannot bring him further more closer to the axis. It is already in the axis. That means adduction is not required. Adduction is not possible. If adduction is not possible, palmar interossei will be absent in middle finger. So palmar interossei pad is absent in middle finger. Do you appreciate, everyone? Could you understand this point? The palmar interossei will be absent in which finger? Middle finger. But what about the dorsal interossei dab? It does the abduction. Abduction is going away from the axis. This can be gone away, this can be gone away. What about the middle finger? Middle finger is already in the axis. Because it is in the axis, it could not be adducted. Can it be abducted? Adduction तो possible नहीं है. क्या abduction हो सकेगा? Abduction हो सकेगा. किस दिशा में? दोनों दिशा में. It can be abducted in both the directions. Why? Because if you are sitting in a center, wherever you move, you will be going away from the center. So it will be abducted this way, it will be abducted this way also. Now before proceeding, please confirm, is this point clear to you? That it can be abducted in both the directions? Yes or no? Everyone clear? Yes? Very good beta. That means we can say, इसको एक muscle यहाँ के लिए चाहिए for one muscle for this side, one muscle for this side. Yes, very good. Two muscles are done. Total are how many? 4. Out of 4, 2 are gone. Remaining are 2 only. One will be taken by index. One will be taken by ring. So who is devoid? Devoid is the thumb. Devoid is the little finger. अगर question आता है who is devoid, answer will be thumb and little finger. अगर question आता है who is having 2, then answer will be middle finger. Please confirm everyone. All the parts here, all the points are clear to you or not? Please confirm. Everyone, quickly. ये सारे points clear हैं? एक बार quickly rapid fire खेलते हैं फिर. ठीक है? Rapid fire. Palmar interossei absent in middle finger. Dorsal interossei double in middle finger. Dorsal interossei absent in thumb. Dorsal interossei absent in little finger. Is that all okay? Everyone clear? And why these two fingers are devoid? Because they have their own abductors. Abductor pollicis brevis, abductor digiti minimi. They don't even need this. Is that all clear? Yes? Very good, beta. Let's move on. This question. Now, if you see the pattern, how the question is evolving, I'll say this topic is kind of permanent topic from where the question is being asked. Sometimes they mark the nerve over here, sometimes they mark the muscle or action, something like that. So what will be the answer to this question? We are looking at which muscle? The name of the muscle is rhomboideus major. If they ask, let me tell you, if they ask single best answer, as per Gray's Anatomy, single best answer is retraction. And why we are writing the retraction this way, R capital, T capital? Because retraction will be done by two muscles. One, rhomboideus, and T means trapezius. So definitely rhomboideus plus trapezius together, they will be doing the retraction, and single best answer is retraction only. But if at all they ask the combination of the action, we can say it will, of course, it will do elevation also because the muscle is from above. It will pull, the scapula will move upward. But is it the vertical pull? No, it is the oblique pull. Because it is the oblique pull, glenoid will face downward. Yes or no? So retraction, yes. Elevation, yes. Glenoid cavity, downward, yes. A, B, and D. That will be the answer. Please confirm, everyone. Did you get the answer? Answer के साथ साथ the whole topic is clear. I will ask the next question now. Which nerve will supply over here? Which nerve will be supplying over here the whole three muscles? Levator, scapulae, rhomboideus minor, rhomboideus major. Three muscles will be supplied by which nerve? Answer is dorsal scapular nerve. Those who have attended the class, I have discussed one very important orientation with you guys. I hope you remember that. Do you remember? वो याद है आपको जो मैंने आपको सिखाया था कि हमारे इसका जो नेमिंग होता है नर्व्स का वो कैसे रहता है? डू यू रिमेंबर दैट? Okay, those who have not attended the class, let me teach something over here now. Let me give you one conceptual understanding. See this part, beta. When our ancestors were quadrupods, that time scapula was like this. When scapula was like this, the nerve coming below is subscapular, below. Above is suprascapular, above. But when we took the erect position, scapula became like this. The one nerve which was below now is in front, but the name is subscapular. The nerve which was above, now it's behind, but the name is suprascapular. Did you get the orientation? Is that all clear? Yes. Now, if I ask you quickly, who is in front? What is your answer? In front of the scapula, answer subscapular. Behind the scapula, answer suprascapular. And medial to the scapula, answer is dorsal scapular. Is it all clear, beta? Everyone? All clear? Yes? Very good. चलो अब हम आगे बढ़ते हैं अगले टॉपिक की तरफ. Next topic is ventral mesogastrium include all except. So when they say ventral or dorsal, you just think wisely. We have the stomach. Who is in front? Liver. Who is behind? Spleen. तो अगर हमारा stomach, liver or further in front, that will be called ventral mesogastrium. Stomach or spleen or towards the behind, that will be called dorsal mesogastrium. Okay. So where is the falciform ligament? It is between the anterior wall and the liver. तो लीवर के भी फ्रंट में, डेफिनेटली इन फ्रंट ऑफ द स्टमक. कोरोनरी लिगामेंट रिलेटेड टू लीवर इटसेल्फ, मींस इन फ्रंट ऑफ द स्टमक. lesser omentum between the liver and the stomach, definitely in front of the stomach. But gastrosplenic between the stomach and spleen, spleen is behind. That's why answer will be D. So this is quick way to answer. All right. So you want further explanation? No problem. I will go in detail then. No problem बेटा, मैं आपको explain कर देता हूँ. अब आप ध्यान रखो, ठीक है? यहाँ से start करेंगे. Let me draw this way. We have like this is anterior wall, this is posterior wall of abdomen. ये diaphragm है. Anterior wall, posterior wall, diaphragm. This is what is the stomach. What is this? Is the stomach. Anterior to stomach, we have ventral mesogastrium. Behind we have dorsal mesogastrium. When the stomach is developing here, the ventral mesogastrium, the liver is developing over here, and the spleen is developing over here. Do you appreciate now? So, dear friends, what will happen? Between the stomach and the spleen, one ligament will be there, and behind one ligament will be there. But spleen did not divide the everything because spleen का size so small है. So stomach and the diaphragm is having one ligament. So this ligament will be called as gastrophrenic. Why? Because between the stomach and the diaphragm. So gastrophrenic ligament. This ligament will be called as gastrosplenic ligament. This ligament will be called as lieno-renal ligament. And something which is hanging around the greater curvature. What hangs around the greater curvature? Greater omentum. So that is what is greater omentum. Now please confirm, did you understand all the derivatives of dorsal mesogastrium? यहाँ तक clear है? Yes. In front, if you see, let me change the color. In front we have something between the liver and the stomach, and something between the anterior wall and the liver like this. This will be lesser omentum because that is along the lesser curvature of the stomach, so lesser omentum. This will be falciform ligament. This will be falciform ligament. But here we can see one area is bare area. Here we can see, just a moment. Here we have the bare area because the peritoneum wants to go and cross. Can it cross? No, liver is attached. It will be reflected back. On this side also, it will be reflected back. So we have the bare area where the liver is in contact with the diaphragm. All the peritoneum will be reflected back. All the peritoneum will be reflected back. Together these two, this one and this one, because it will be all around. And we have taken a section, but actually bare area is a round area. We have the right, left, triangular ligament, anterior posterior coronary ligament, है ना? So right now we are in the section. We can't say which one is what, but we can say overall all the reflections taken together, they are going to make the two ligaments, coronary ligament and the triangular ligament. Coronary and the triangular ligament. So these will be the derivative of ventral mesogastrium. Is it clear beta everyone? जिनको पहले नहीं clear था अभी clear है? Yes. One concept if I add over here, during the fetal life we have the umbilical vein coming over here, umbilical vein. It wants to reach the liver. It will reach the liver via the falciform ligament. It becomes content of the falciform ligament and reach the liver. Umbilical vein liver तक पहुंच गई क्योंकि liver के अंदर होता है ductus venosus, ठीक है? But after birth, this portion will go away. Outer portion तो shed off हो जाएगा. But inner portion will persist ना. Inner portion will persist as what? Inner portion, this much part will persist as ligamentum teres. And that ligamentum teres will be the content of falciform ligament. Now, even though it seems little bit amazing to know that like ligamentum, एक ligament दूसरे ligament का content क्यों है, but actually क्या है, this is earlier it was a vein, that time it was content, later it converted into ligament, that's why it is still the content. Is it all clear beta? Yes. Amit, your question is कि इसमें से कौन सा coronary है और कौन सा triangular है? I have already told you that this is in section, है ना? We are taking a section. Actually, bare area is like this, where we have right and left triangular ligament, anterior posterior coronary ligament. When you take a section, you can't say which one is what, but what you can say, this, and this. All of them taken together, they are part of coronary and triangular ligament. Because right now, आप section में देख रहे हो ना? Are you understanding बेटा? अगर आप सिर्फ एंटीरियर पोस्टीरियर कंसीडर कर रहे हो तो कोरोनरी लिगामेंट है ना? But try to understand this because these all reflections are there. As a whole, we have to learn. So anterior posterior is coronary only, but we do have that triangular ligaments also, and that also is the derivative also ventral mesogastrium. Okay, everyone? ठीक है, आगे बढ़े. Molecular layer of the cerebellum consists of what? Answer is basket cell and stellate cell. This is very important. We need to know which cell is present where. Purkinje cells are present in the Purkinje layer, and these two cells are present in the granular layer. Okay. And what are the deep nuclei? We have the mnemonic. What is our mnemonic? Doctors eat good food. So dentate, emboliform, globose, and fastigial. Is that all okay? Now, how to identify? See, this cell which is neither fitting in this layer nor fitting in this layer. You can see here also, these cells which are jutting out cells, these will be Purkinje cell and the other side will be molecular and the black will be granular cell. Is that all clear? Everyone, please give a quick feedback till now. Whatever we have discussed, is everything fine? So far, so good? What is this? Basket cell, stellate cell. Let's look at the arrangement. What is this? Purkinje cells. Where is the dendrite of the Purkinje? Above. And what is this? Is the climbing fiber coming from the olivary nucleus. And because it is coming from a single nucleus, it can climb up to the highest level. It can directly communicate with the Purkinje fibers. But what is this cell? Granule cell, which is helping the mossy fiber. Mossy fiber is coming from all other sources. All other sources it is coming from. Okay. And then here if I ask you, what is the output of the cerebellar cortex? What will be the answer? Output of the cerebellar cortex. Output from cerebellar cortex. Answer is what? Tell me. Purkinje cells. But if I ask you output as a whole from the cerebellum, what will be the answer? As a whole, cerebellum, that will be deep nuclei. So far, so good. Next question. What will be the answer and what is the given condition? So this is straightforward question. Absent thymus and hypoparathyroidism. We are dealing with the Digeorge syndrome. We are dealing with the Digeorge syndrome. And A is the answer here because A is the third pharyngeal pouch which deals with the thymus. Along with that, inferior parathyroid. Whereas here we have the tubotympanic. Tubo means auditory tube. Tympanic means tympanic cavity, middle ear. And here we have what? Tonsil, the tonsillar fossa and the tonsil as a whole. Is that all okay? So what happened to the chat? Chat may, why it is not showing? And what about this? Ultimobranchial body and superior parathyroid. Okay. Now this question, beta, tell me what will be the answer. This is a little bit tricky. This is having one catch. What is the catch? The patient is having the burn in the skin and they're asking which one will be injured. Now my question is, does the skin have any somatic efferent or any efferent for that matter? No. Skin does not have any efferent fibers. So GSC is not present. If it is absent, how it will be burned? It won't be burned. GVE, parasympathetic fibers. It is absent in the skin. In the skin कोई parasympathetic fiber तो होते ही नहीं है ना? ट्रॉफिक हार्मोन, कोई ऐसा ट्रॉफिक हार्मोन है जो स्किन से प्रोड्यूस होता है? कोई ट्रॉफिक हार्मोन स्किन से प्रोड्यूस होता ही नहीं है ना? That will be also absent. So among the given option, only one thing is present, that is the exocrine gland. Which gland is present? Sweat gland and the sebaceous gland. Both are exocrine glands. And because that is present, that will be involved in the burn. So that was little bit catch. कि बाकी तीन structure है ही नहीं. ठीक है? Yes. I can't see the chat is not coming. Why? The session is going live. अच्छा ये बताओ इसमें क्या आंसर है फिर? What will be the answer? This question has been asked 2 to 3 times before. Okay, so that is very important actually. All right, now it is showing. All right, beta. All right, so it was some glitch was there, but now I can see now, no problem. So those, let me tell you one thing. Those who have remembered the E. colima, you stick with that only. Last moment pay, there should not be any change in the mnemonic or any concept or something. Those who have not remembered, for them I am just mnemonic is also there. What is that? Let me teach that way. That goes like spiral, CT, slim, 41, 42. Now, of course, I totally agree that with the word slim, the number 41, 42 is not doing any justification. It should be 26, 28. I totally understand. But I am writing 41, 42 because the primary auditory area number is 41, 42. Is that all okay? Yes. Let's start. So here we are going to start with the first thing, spiral organ of corti or the spiral ganglion. Okay. Spiral ganglion or spiral organ of corti, which will be the receiver. It will be the receiver. It will be sending the fibers to the cochlear nucleus. It will be sending the fibers to the cochlear nucleus. So spiral is done. C is done. What is T? T is the trapezoid body. T is the trapezoid body. Now, let me tell you first what is trapezoid body. Trapezoid body is formed by the fibers which are crossing from left to right side and right to left side. Because of the decussation of the fibers, the body is formed, which is called as trapezoid body. That means now the pathway will shift to this side and we will reach over here. That is S. S for superior olivary nucleus. Before proceeding, this is the center of stapedial reflex. It is the center of stapedial reflex. Then the fibers will reach inferior colliculus in the form of lateral lemniscus. The fibers going over here will be called as lateral lemniscus. Then the fibers will reach to the medial geniculate body and then to the area number 41, 42. Is it clear to everyone? Yes, right. Hanji. So let me also tell you that I'm going to open the Telegram group and I already posted one message over there that I am going to share the schedule with you guys. By tomorrow I will share and we are going to start our quizzes because the time has come for the final. अभी फाइनल लैब खेलना है हमें, है ना, और अपना पुश जो भी लास्ट पुश है वो लगा देना है. ओके, ठीक है बेटा. Those who are already there in my Telegram group, they are all definitely welcome to join the quiz. Those who are not there, they can also join and you can participate in the quiz for quick revision just to be in touch with the subject. Okay. All right. Chalo. Next question. Downward enlargement of the spleen prevented by straightforward question. Phrenico-colic ligament. Why? Because it is the diaphragm, it is the colic. Between them we have a support of the spleen. That is why it is also called as sustentaculum linis. That is why it is also called as sustentaculum linis. ठीक है? So far so good. It will be more or less contralateral. Yes, that is true, Patel. But actually we have bilateral. Pathway bilateral जाते हैं, few fibers will not cross. That is, if you look at the higher anatomy, few fibers will not cross. तो ऐसा नहीं है कि complete loss होगा, but more loss will be on the contralateral side. Okay. Now this image, what will be your answer? We have three foramen in line, which can be remembered as ROS, rotundum, ovale, spinosum. And who has been marked here? Ovale. Ovale will allow male structure to pass through. What is M? Mandibular nerve, not the maxillary nerve. Maxillary nerve will pass from foramen rotundum. उसके लिए हमारा mnemonic क्या होता है? Maximum round. You remember that? So what is A? Is accessory meningeal artery. What is L? Lesser petrosal nerve. And what is E? Is emissary vein. Is that all okay? Now foramen of skull is very important area बेटा. उस पे बहुत बार क्वेश्चन आए हैं, आगे भी आते रहेंगे. I always start with the foramen of skull. I always tell this is a very small topic but high yield topic. Question will be definitely. So please go through that area. Okay? उसको बहुत अच्छे से याद करना है, पूरा रट देना है आपने उसको. ठीक है? MTR कर देना है. MTR क्या है? मारो टोटल रट्टा. राइट? जो जिन लोगों ने यूजी में नीट यूजी से पहले ये सुना होगा आपने टर्म, है ना, कई सारे लोगों ने ये पहले सुना होगा क्योंकि यूजी के इंस्टीट्यूट्स में इसको यूज करते थे हम लोग. MTR कर दो. This image was not there in the test, so I sincerely apologize. I don't know. I sent it, but by mistake it was not there. But now I think the topic as well as part is everything okay. Next question, aneurysm of which artery is a straightforward question, and answer is anterior communicating artery aneurysm. If there is a compression as the optic chiasma, which ऑप्टिक कियाज्मा, अब बताओ इसमें कौन सा कंप्रेशन, कौन सा डिफेक्ट आएगा? याद है अमित? इसमें कौन सा कंप्रेशन है? डिफेक्ट क्या आएगा? व्हाट्स द डिफेक्ट? Bitemporal hemianopia. Bitemporal hemianopia. Very good. Now let me ask you guys, if there is a defect in the optic pathway involving the temporal lobe, what will be the answer? Pie in the sky or pie on the floor? If the temporal lobe is gone, see, let me give you very simple hint. In optic pathway, everything is ulta pulta. It is crisscross. Okay. So look at the parietal lobe and the temporal lobe. Parietal lobe is above, temporal lobe is below. Below lobe is gone, defect will be above. Parietal lobe above is gone, defect will be below. So temporal lobe gone, pie in the sky. Parietal lobe gone, pie on the floor. Will you remember this? And the name of the loop is Mayer's loop. The name of the loop involving the temporal lobe is Mayer's loop. All these are important points. Question can be asked, beta. Okay? Are you done? Next. अब बताओ इसमें क्या है? This is very simple question, even though some clinical setting is given. But finally, what examiner wants to know, that there is a paralysis of posterior belly of the digastric muscle. Now we have two bellies of the digastric, anterior belly of digastric coming from the first arch, posterior belly of digastric coming from the second arch. First arch now supply mandibular nerve, second arch now supply facial nerve. Straightforward answer is facial nerve. ठीक है? All right. What is this testing of the thumb? We are doing the abduction. What is this action? ये क्या है? Plane से away जाना. Away क्या होता है? Abduction. This is abduction. This is adduction. This is extension. This is flexion. You understand? Flexion, extension, abduction, adduction. This is how we used to show in the first year. And this is the circumduction. Is that all okay? So what is this pen test abduction? Median nerve. And what are these cells? What is the slide? This is the follicle, this is the follicle, this is the follicle. The slide belongs to thyroid. And the cell which has been marked is parafollicular C cells, which are going to produce calcitonin. Right? Now, dear friends, we have finished up to this much part. Still, some questions are there. 3 more questions are there. But before going there, I would like to ask one thing. Please, can you tell me honestly कि आपका कॉन्फिडेंस थोड़ा बहुत बिल्डअप हुआ, बेटर हुआ इस टॉपिक्स को डिस्कस करने के बाद? आफ्टर डिस्कसिंग दिस टॉपिक्स, यू आर फीलिंग लिटिल बिट मोर कॉन्फिडेंट एंड मोर कंफर्टेबल इन एनाटॉमी? Was it useful for you guys? Helpful? Yes or no? Give me quick feedback, beta. ठीक है, मजा आया अभी तक का? ठीक है बेटा. जोन ने स्टार्टिंग में कहा था कि थोड़ा बहुत वो शेयर करने के लिए, तो आई होप कि कुछ शेयर तो हो गया, आपके साथ पहुंचा वो मैसेज. तो व्हाट आई वांटेड टू गेट अक्रॉस द मैसेज हैज रीच्ड ओवर देयर. दैट इज अ वेरी गुड थिंग. Always, beta, whenever you're looking at a picture, do not only look at the picture, do not only look at the answer. Go beyond that. Try to look at the as a whole concept. When you're looking at it as a whole concept, you will never lose. वो क्वेश्चन की लैंग्वेज बदल देंगे, हमें क्या फर्क पड़ता है? सानू की, है ना? वो क्वेश्चन की ऑप्शन बदल देंगे, सानू की. हमें क्या करना है? टॉपिक को क्लियर करना है. इज दैट ऑल ओके? अच्छा, अब आप ये बताओ बेटा, नेक्स्ट क्वेश्चन. Yes, of course, DVT and PYQs will put in a very good condition, beta, है ना? Very comfortable position they will put you in. I have designed that way. Now, my next question is, who can now promise that, sir, I promise I will give my 100%. I don't care about the result, but I will give my 100%. Who can give me that commitment? क्योंकि when you are working honestly and with sincerity, rest is up to God. The result is not in our hand, but the efforts are. Are you understanding? Now, who will give me the commitment, sir? I am going to commit 100%. I'll give my 100%. I don't care about the result. I don't know what will be the result, but I will not have any regret. Who can give me that commitment, beta? Yes. Let me check in the yes. Let us bring some positivity. The wave of positivity should be there in the chat box right now. Yes, beta. Very good. Very good. वेरी गुड बेटा. हमें हमारा 100% देना है. यस. बाकी रब रखा, है ना? और जब रब रखा है तो हमें डरने की कोई जरूरत नहीं। करेक्ट है ना बेटा? आप एग्री करते हो इस बात से? है ना? वेरी गुड बेटा, आप अच्छे से। अब अपना लास्ट लैप है। हमारी क्या स्ट्रेटेजी होती है, हम पहले धीरे 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 रन करते हैं, लास्ट लैप में पूरी जान लगा देंगे। पूरी जान लगा देंगे तो बाकी भी सरप्राइज हो जाएंगे, सराउंडिंग वाले फ्रेंड्स भी सरप्राइज हो जाएंगे। और कुछ हमारे वेल विशर्स हैं जिनको हमें आंसर देना है। कैसे देंगे आंसर? बाय आवर सक्सेस। वी विल नॉट रिप्लाई, आवर सक्सेस विल रिप्लाई। यू रिमेंबर दैट? हमें हमारी सक्सेस से उन्हें आंसर देना है बेटा। करेक्ट है ना? यस। चलो, अब ये क्वेश्चन पे आते हैं। All of the following veins are formed from vitelline vein except. Please remember, vitelline vein are going to make the ship structure. Ship structure, where we have superior mesenteric vein, we have hepatic vein, we have IVC, and we have portal vein. But superior vena cava will not be formed from here. All right. Now this question, which of the following is comprised of dense irregular tissue? What will be your answer? Dense irregular tissue. Dense irregular tissue, इसको समझने के लिए answer will be dermis, but let me give you one concept, it will hardly take 2 minutes, okay? So we have the loose tissue when the gap between the cell is more. We have the dense tissue when the gap between the cell is less. We have regular if the fibers in one direction. Fibers in one direction, then we say regular. And our mnemonic is TAL. What is TAL? Tendon, aponeurosis, ligament. Because if you think of a muscle, whatever work it will do always the same action. So muscle fibers, tendon fibers are arranged in one direction. Tendon is regular. Flat tendon, aponeurosis, is also regular, and its cousin, ligament, that is also regular. So tendon, aponeurosis, ligament. Repeat with me. TAL, tendon, aponeurosis, ligament. These three are regular examples. Okay. Then dense irregular. Whenever you come across this term, you think of cover. Why? Because when you try to cover any object, you will wrap up in all the direction. So fiber in multiple direction, by definition, it is irregular. Look at the options. Dermis, it is a cover. For the glands, capsule is the cover. Blood vessels, adventitia is the cover. On the nerve and muscle, we have the sheath like perimysium, perineurium. All those sheaths are nothing but the covers. Then for the bone, we have the periosteum. For the cartilage, we have perichondrium. All these are nothing but the covers. Do you agree? So covers means dense irregular. TAL means dense regular. And loose tissue, whatever we remember from our first year, that is more than sufficient for us. Like we all remember lamina propria, we all remember submucosal tissue, subaerular tissue, loose aerular tissue. All those are nothing but the loose tissue. Is that all okay? Now, after having understood the concept, let us go back to the question again. Now, when I am attempting this question now, dense irregular tissue, my approach to the question changed because now I am thinking in line of cover. That who will be the cover? Answer is dermis. That's okay. Even before we know that answer is dermis, that's okay. But right now we can tell about all the options. We know about A, C, and D as well, that they belong to which category, isn't it? So that's the difference between learning a question and learning a concept. Okay. Since question 1, what we have done, we have gone beyond and we have tried to cover all the points relevant to that particular topic, so that if at all any question or any language, anything is changed, we don't worry, we will be able to mark the correct answer. Is that all okay? Yes. Now, dear friends, the last question, urothelium lines all except. Urothelium, transitional epithelium, is present in the urinary system. It is having a property of distensibility undergoing stretch. It is a stratified epithelium. It is really multi-layered. Even after stretch, it remains multi-layered. That's the beauty of it. Second important point, it protects the tissue from the harmful effect of the urine. So it is present where? In the calyces it is present, yes. In the ureter, it will be present, yes. Bladder, it will be present, yes. Along with the bladder, just continuing part of the urethra, static urethra, it will be present, no? Membranous urethra. Membranous urethra, urothelium will be absent. So looking at the urothelium, where it is present, this is present in the collecting tubules, calyces, pelvis, ureter, bladder, and proximal urethra, particularly prostatic urethra. Only up to this much part. Beyond that, what changes are there? Look at this. Prostatic urethra will be urothelium because in continuity. End will be stratified squamous epithelium just like any other opening of the body, like vagina, anal canal. You look at the external acoustic meatus, everywhere openings are stratified squamous only. Okay. And then we have these two parts of the urethra which is lined by pseudostratified columnar epithelium. I hope that makes sense. So in the beginning transitional, then pseudostratified columnar, and then stratified squamous epithelium. So far so good. So that was all, dear friends. This is me, and if you guys are there on this Instagram, this is my Instagram, Dr_Sandeep_Madaan, and this is my YouTube channel, and this is my Telegram. Those, as I was telling that we are going to start the quizzes, I'll be doing the quizzes on this Telegram, Dr. Sandeep, DAMS Anatomy. And you see, Instagram, I'll be putting the updates, and you can send me the DM on the Instagram as well for your doubts. I hope everything was fine. Yes. तो अपना हमें बेस्ट देना है, ये हमेशा याद रखना है, डियर फ्रेंड्स, that we will give our best. Rest is up to God. Is that okay? So अपना बेस्ट दो, बाकी रब रखा बेटा. Thank you so much everyone. Thank you so much. It was pleasure meeting you guys across the screen, and I am looking forward to meet you guys again on the other side. जब आपने एग्जाम को क्रैक कर लिया होगा, we will celebrate your success. Yes. मिलेंगे दोबारा.